considered fully vaccinated, you can enter society. Now they're saying no. Now you have to have a third. And now they're considering a fourth, which is wild. And there's no end in sight.
You know, if it was about COVID, I would say that the world would have adopted something what I presented to the American people and the Senate testimony in November of 2020. I told America, listen, there's 4 pillars to pandemic response. We should have always seen teams of doctors in Washington. I would have went if they called me. In fact, I emailed it. They knew who I am. We would have seen teams of doctors in Washington working on 4 pillars. The first pillar is reduce the spread of infection. Terrific. You know, everything we can to improve airflow. We know it's spread by the air. It's not a hand infection. This focus on hand sanitizers, like we're all getting infected hands.
That's pretty early on, though, wasn't it?
It's not even, no. You still go on DFW Airport. There's hand sanitizers every 6 feet. There was pictures of people spraying football stadiums with sanitizer. It's not spread on football seats. It's not a contact organism. It's not Ebola. It's not Clostridium difficile. It's spread in the air. But if we would have focused on contagion control that was reasonable, that would have been terrific. The most effective contagion control, by the way, is 2021 data, is actually using oral nasal virucidal therapy, far and away.
Yeah, explain that, please.
Yeah, oral nasal virucidal therapy is basically using, virtually anything kills the virus. Any disinfectant kills the virus. Iodine kills it on contact. So if we use dilute betadine, and so if you take a betadine over the counter, it's a brown bottle. We use it to sterilize wounds in the ER. Buy it at any pharmacy and take 2 teaspoons in 6 ounces of water. Take a nasal spray or a syringe bulb and spray it up your nose, snort it back to the points in the back of your throat and spit it out. I'm sorry, that's gross for your audience, but you got to get it up there and back. That adequately decontaminates the nose. Then gargle with the rest of it, spit it out. Finish up with some scope or Listerine. Doing that after you return from a day out with contact with people, especially close contact in close rooms. I'm talking public restrooms, small conference rooms. You have to be in contact with someone for about 3 hours, honestly, in a small room with no airflow to get it. Or go into a loaded room like a public restroom or tight places at small stores. That the bottom line, that's where people get it from. Once it gets home, 85% of it spreads in the house. But using oral nasal virucidal therapy is such a huge advance that in a randomized trial by Chowdhury and colleagues from Bangladesh, 303 patients randomized to this virucidal therapy, which is all topical, no prescription drugs, nothing else needed, versus a control group, which was just warm water. 303 patients in each group. It dramatically reduced the PCR positivity by day 3. It knocked it down from 303 down to 24 patients, still